everyone. So today we'll try to understand what exactly is specific learning disabilities, which is abbreviated as SLD in short. Right? So this indeed is a very fundamental yet important topic that comes under inclusive education. So before starting off with the actual topic, let me try to highlight as to why we are studying this concept or why exactly is the need for understanding this concept. The answer is quite simple. Because we as future teachers, if we need to really build an environment or a space where every student feels included, we should be aware of what are the specific learning disabilities that occur within few minority of our students. We truly should be able to help them as as teachers. We truly should be able to identify such difficulties, find out ways by which we could approach them, and thereby help them in their learning process. So that exactly is the importance as to studying this whole concept of specific learning disabilities. Okay, so we'll try to understand this whole concept in a very detailed manner. So firstly, let's have a brief introduction. So what exactly is SLD? SLD stands for Specific Learning Disability, or SLD is a neurodevelopmental condition, we can say. Right? This means that the child's brain develops in a slightly different manner or in a different way, especially with regards to how it processes information related to the aspects of learning. Okay, so that means that the brain usually finds a little difficulty in processing information. Okay, so that is the main point here. It finds it difficult to process information related to the aspects of learning, right? So one important thing that we must clearly understand, or we must clearly notice, that SLD does not affect the overall intelligence of a child. Okay, a person or a student with SLD can just be as intelligent, creative and capable as any other ordinary student. Okay, so there is this only aspect of a difficulty in processing certain information related to the learning process. So that is the only delimitation that a child with disability or a child with SLD may tend to face, right? Nothing is wrong with that child. There is nothing else to fix in that child. The only thing is he may find difficulty in the areas of reading, writing or mathematics, let's suppose. Okay, so these are the key areas where the students might feel a little difficult. So as we've clearly mentioned, there would be certain sort of difficulties that may tend to arise with children with SLD, right? But the main factor that we need to keep in our mind is that these difficulties are not due to the intelligence of a child, okay? And it doesn't really have anything to deal with the overall ability of a child. That means that these disabilities may be very specific. That means it just pinpoints towards certain areas like reading, writing or mathematical calculations. But it doesn't really, meddle with the intelligence or pure ability of a child. Okay, and these difficulties may tend to arise even after proper instruction and guidance, or rather opportunities being provided to the learners. Okay, so we need to keep in mind that these are not due to low intelligence of a child. They may tend to occur despite adequate instruction and opportunities provided to the learners, as well as they are specific and not affecting overall ability of a child. Okay, and SLD mainly includes three different aspects. As I said, these may be pointed towards certain areas like reading, writing or mathematical calculations, and based on that aspects it has been divided into three different domains. Okay, once a child feels a little difficulty in reading, it is basically termed as dyslexia, right? And once a person or a student is struggling with the aspects of writing, it is called as dysgraphia. And those with mathematical difficulties or calculation errors or calculation difficulties are basically called as dyscalculia. Okay, so I hope it is clear. Next is DSM-5 understanding. So DSM is basically a very standard model that basically is a diagnostic manual, we can say, which is being used in a worldwide manner in a uniform scale. This manual is being used, and such a set of difficulties that may tend to qualify the conditions provided in this manual is regarded as SLD. Okay, so SLD is identified when a student shows persistent difficulty in learning academic skills. Okay, once a student faces a certain difficulties, a persistent one, those that is continuous over certain time, we can regard it as SLD as per the DSM-5 understanding, or as per this manual, we can regard any sort of difficulty that is persistent towards a certain amount of time as an SLD, or a specific learning disability, right? It should be a specific academic skill that the student finds a little difficulty in understanding. Okay, another parameter is that even after proper teaching, or even after the proper support from teacher side is being provided, still the students finds a little difficulty in doing certain things, we can regard that particular disability into SLD. Okay, so these difficulties are mainly seen in three areas. As per the DSM-5, it is being narrowed down into the aspects of reading, writing and mathematics. Okay, so according to DSM-5, there are certain conditions that is being put forward by this manual to be regarded as an SLD. Okay, so this manual puts forward three different areas like reading, writing and mathematics, and anyone who finds a little difficulty in these areas can be regarded as dyslexia, dyscalculia and dysgraphia. Okay, and these difficulties, or these academic skills difficulties, should be persistent for like almost 6 months. Okay, only then according to this manual that difficulty can be regarded as a disability. Okay, so there is a stark difference between what exactly is a difficulty and how we can regard it as a disability for a child. So often in our normal context, we may tend to find certain differences between what exactly is SLD, that is specific learning disability, and what is difficulty, normal difficulty with regards to academic journey. We know that normally when we have a teacher who is not very much affluent with his subject matters, or he is not able to deliver his concepts in a very effective manner, so in that case we as students may tend to face a little difficulty understanding his subject, right? So this basically is temporary, right? Once we change the approach by which we can learn that subject, once we change our teachers, or once we learn from any sort of extra resources, that difficulty just vanishes, right? So that means that this is a temporary challenge, or it's a temporary difficulty that may tend to arise in our academic journey, right? But once we talk about a disability, it's a persistent one. Okay, even though we provide them with the quality instruction, still they may tend to face a little difficulty in the aspects of reading, writing or calculation, as I already mentioned. Okay, so this rather is a persistent one, it just lasts longer. So that is the main difference between what exactly is a disability and a difficulty. Okay, so a learning problem can happen due to lack of practice, poor teaching or environmental factors, and it's usually temporary. But an intellectual disability, on the other hand, overall affects the cognitive ability, right? So that means that the child struggles in most of the areas of that particular learning process. Okay, so he may tend to struggle in the aspects of reading, writing or calculations and so on, right? But SLD, as we say, is specific. It just narrows down to these aspects of difficulties. Okay, the child may struggle in one area like reading, but they can perform well in any other areas. Okay, so we can conclude that SLD is not about how smart a student is, it's about how they learn, how they process information. Okay, so that is the stark difference between what exactly is an SLD and what is the other basic difficulties that the child may face. Now let's talk about the prevalence of these disabilities. Okay, so that means that in a very worldwide scale, these disabilities are quite common in today's realm. So research shows that around 5 to 15% of school children have some form of SLD. It's quite unnoticed and it's quite unfortunate that in today's realm, these are still not being addressed. So we as teachers must be, educating ourselves with what are the struggles that a student with SLD may tend to face, how we can approach them, and what is the seriousness of this issue, right? So that means that in a typical classroom, at least 2 to 5 students may be silently struggling. So we as teachers must surely serve as a very helping hand for them, right? So, and many of them go unnoticed or even misunderstood for their difficulty. Now let's talk about the specific causes that may lead to SLD, right? So often at times, the students with SLD is being blamed badly for their condition. But it isn't that way, it goes beyond that. The major parameter is the differences in brain functioning. So how their brain functions and processes information is the one that determines their specific learning disability. Okay, the second factor is genetic factors or genetic variations. So this may lead to a difference in how their brain processes information as well as language. That leads to again specific learning disabilities. Now we need to be clear that what are the different factors that do not add up to the cause of specific learning disabilities. So we need to be clear that it is purely not due to the laziness of a child, it's not due to the lack of intelligence of a child, and also it's not due to poor parenting or any sort of instructional modalities or instructional deficiencies from the side of teachers, right? It's purely in a way how their brain processes information. Now let's talk about the neurological perspective of SLD. So in students with SLD, certain areas of brain involved in language, memory and processing work differently, and that is the major reason why they tend to process these things differently, and that leads to their specific learning disabilities, right? So this is purely a neurodevelopmental condition. So this doesn't mean that something is seriously wrong with that child. It just means that the brain is wired differently, and because of this, they may need different ways of learning, not more pressure. So that typically means that they are facing certain difficulties in different areas, and this is not something that needs to be fixed with pressure towards the child. It typically means that we as teachers must develop ways by which we could approach them. How can we support their learning is what we need to focus. Rather than their problems that needs to be fixed, we should be finding our ways by which we can support them. So we should be keeping in mind that specific learning disability is a pure neurological perspective, or it's a neurological condition, right? Next thing is that as a conclusion, I'd like to highlight why this matters, right? So as future teachers, clear understanding of SLD is very important. It's not an optional choice that we may or may not learn SLD. It's very compulsory that we need to educate ourselves with what are the specific learning disabilities, how can we categorize them, how can we approach them. It's quite important in today's era, because if we fail to recognize it, students may feel inferior among them. That leads to serious identity crisis. They may lose confidence all of a sudden, right? And sometimes they may even stop trying altogether. On the other hand, if we truly assimilate ourselves with these concepts and we as teachers equip ourselves with the concepts of SLDs, we can entirely change their learning experience. So that leads to the formation of a dynamic, inclusive as well as efficient learning environment. Okay, so that's all about SLD. We had a very brief understanding of the introduction towards our seminar topic. Now the following topics would be dealt by my other team members. So this is me, Navneeta. I'm from BSc BA Physics, third year, and thank you for listening, right?